I believe that nurses, as patient advocates, of leaders of change, that are innovators, they embrace evidence-based research, I believe we can change the health of our nation.
The Jonases have said, okay, this is our agenda. We are going to prepare faculty for the future who will take care of this burgeoning need for nursing so that nursing students can enter programs that have qualified faculty.
Connecting with the Jonas Center has really given me an opportunity to see how I can influence policy, both at a state level, within my own institution, as well as on a national level, an experience that I would not have had if it wasn't for the Jonas Center.
And so that's what's important is as nurses, we need to be involved in policy making because that's where changes, bigger changes can happen.
Mr. and Mrs. Jonas, as philanthropists, they've been able to do wonderful things to move the understanding of what it takes to be a nurse educator forward.
They're involved in making sure that they are supporting the best cadre of leaders as Jonas Scholars.
Nursing can improve the health of Americans by preparing today's and tomorrow's leaders. As we prepare leaders, we get a voice. As we get a voice, we get stronger. As we get stronger, we get momentum. That momentum pushes us forward and allows us to make change.
We have developed a body of knowledge that can be taught at the undergraduate, the master's, and the doctoral level that is staggering.
We need to make more nurses, so we need to have more doctorally prepared nurses. And we also need to have nurses who are working on research and science so that we can provide better care to folks when they're ill and also when they're well.
We have tremendous numbers of people prepared at the master's level to give superior clinical care in every specialty there is.
We have 200 doctoral scholars in 88 schools. That's all 50 states. Our goal really is to fund 1,000 nurses to get their doctoral degree to fill those spots. Just remember, if we don't have faculty, we don't have nurses.
Something is magical about 1,000. You got to get 1,000.
When you look at a group like this that has come out of 6, I mean, the first time I saw the scholar group, there were 6.
I want that 1,000, I can taste it. I really can.
We need more nurses who are clinically relevant, clinical experts.
I think nurses can really take a unique stance in terms of looking at patients holistically and dealing with problems in an upstream manner, really from the prevention aspect rather than the treatment aspect, though they're strong in that area as well.
As a nurse, I would rather keep them from being sick in the community before I take care of them in the hospital setting.
The commitment of Mr. and Mrs. Jonas to the Khan Academy has now given me the opportunity to be a global leader. I'm outside the walls now. I'm not confined to a university. I'm not confined by the walls of any organization.
And we at the Jonas Center feel it is our due to take on this massive job of dealing with the mental health and the physical health of our returning veterans.
There are roughly 26 million veterans eligible for VA benefits in this country, and only approximately 25% of the veterans receive care in the VA system. And that leaves 75% of our veterans seeking care in the civilian sector. Through the Jonas Foundation, we are educating nursing leaders, educators, faculty, and clinicians to go back into the communities and to the education system to educate future nurses and advanced practice nurses on how to provide health care to our veterans and our active duty military and their families.
And what we're trying to do is have a focus on veterans' health care needs, both in the academic setting and then building that knowledge base so when those nurses graduate, they can bring that knowledge base not only back to military treatment facilities or Veterans Administration facilities, but back out to the hospitals and the local communities throughout the country who can then take that knowledge and give our veterans a far higher level of care.
Every nurse takes care of up to 18,000 patients in their career.
For about a year now, I have been, in a way, shadowing nurse leaders, and I've seen how their work really does translate to the policies that affect the people in North Carolina.
And then, Mr. Jonas, thank you very much. You know, you have, I believe, given a platform for the voice of nursing and the profession and are making a difference in ways that you will probably never realize because the impact of education extends far beyond the day that they're being educated and into the many touch points that they'll have across the world.
The Jonas Center is the leading philanthropic organization in our country today supporting the development of nursing faculty.
And when medical care can not do anything else for the patient, nursing is always there. We're innovative, we're diverse, and part of nursing is caring. We actually care for the patient, whether there's a cure or not.
You have a chance to make a difference in your communities. All of you are not just able to take care of a fracture. All of you are here to deal with a fractured country and with all the dissension that we're facing now. And you are educated and wise and hopefully extraordinarily well trained. And I know that there will be a very big difference in our country because of your profession. And I'm proud to play a very small part in it. Thank you.